Hi, my name is Chelsea, and today I'm going to be performing the trach care. I have the appropriate attire on. I have my badge and it's visible, no jewelry, and I don't have any nail polish. So first thing I'm going to do is I'm going to enter maintain privacy for the patient, whether that's closing the door or drawing the curtain. I did do my 2 patient identifiers already. So now what I'm going to be doing is placing the patient in a high Fowler's position. I do have my trach tray here and some clean gloves. So first thing I'm going to do is perform my hand hygiene, and then I am going to peel away. Here's the sterile gloves, and then I have here I want to make sure that I'm putting the drape with the shiny side down. You can't really tell, but I'm just going to verbalize that. And then I'm going to dump all of the supplies that are in here on to my mat, my sterile mat. And then next thing I'm going to do now is I have to simulate. I don't have any normal saline or the hydrogen peroxide. So I would have both, one of the mixture and then the normal saline. So now what I'm going to do is I am going to perform my hand hygiene, then put the clean gloves on. Once I have the gloves on, I would remove the oxygen source. And then what I'm going to do here is I'm just going to unlock it first and then remove the inner cannula. Make sure that I'm maintaining the curvature. And I'm going to drop that into the solution there. And then I'm going to go ahead and remove the gauze as well. And we're just going to throw that in the trash. Now I'm going to remove my gloves in the trash. I'm going to perform hand hygiene again, and now I'm going to put on my sterile gloves. So integrity looks good. Just going to open this right here. Open this up. And then what I'm going to do is I'm going to take my non-dominant hand, pinch the inside, put my right hand in. Perfect. Gonna go on the outer portion in the cuff. Go ahead and put on my other glove here. And I'm gonna pick this up. And this would go in the trash. And then now that I have my gloves on, this is going to be my sterile hand. This is going to be the dirty one. I do have everything that I need here. I have the tie, I have the gauze, I have the applicators, and then the brush to clean the cannula. So I'm going to go ahead and start with that. I'm going to go ahead and clean the cannula, rinse, and then I'm going to dump the brush, and then we're going to go ahead and put the inner cannula back in, make sure that we maintain the curvature lock. And then now what I'm going to do is we're going to go ahead and put the applicators in the sterile wash. And then we're going to go ahead and we're going to clean around, dump, clean around, dump, clean around, dump. And then after that, we're going to get some gauze, and we are going to just clean up and maintain, make sure that there's no wet or soiled area. We want to make sure that it's all dry. And then what we're going to do is we are going to replace the gauze as well. And I'm just going to grab the same one that I used really quick, just because I didn't have a different gauze to pat dry. So go ahead and put that. And then we are going to remove now the tie. Throw those in the trash. I'm going to do the one-tie method. I already made my slit. Double knot it here. Okay. Then some gauze. I want to make sure that it's not too tight and put this gauze underneath just to reduce the risk of any skin breakdown. Perfect. So now we're going to go ahead and throw everything away. Make sure that the patient tolerated the procedure well. I'm going to go ahead and remove my gloves. And then perform my hand hygiene and then place the patient back down in a low position. And that's it. Thank you.